Hello, and thank you for joining me again today on the Finding Hope After Loss podcast. Today, I wanted to talk about a new piece of research I recently saw that really caught my attention, mainly because it looks specifically at the mental health impact of pregnancy loss before 24 weeks. I think this is a really important conversation to have because for many people, there's still this idea that if a pregnancy loss happens early, that somehow it mattered less and that somehow the grief should be easier to deal with. Or even that you should be able to just move forward and move on quicker. So I was curious, what does this research actually show? So there was a new umbrella review published in Human Reproduction in July of 2026. And this looked at the emotional and the psychological impact of pregnancy loss before 24 weeks. Now, to be clear, this wasn't just one small study. The researchers actually brought together a huge amount of existing research to look at what happens emotionally after these losses, both immediately and with extended time. So I wanted to break down exactly what they found, what I found interesting, and why I think it matters. And just as always, this episode is for educational purposes and is not ever medical advice. So what did they actually study? So as I mentioned, this is what's called an umbrella review. Basically, instead of looking at just one group of people or even combining a handful of studies, the researchers reviewed existing reviews on the topic. So they included 18 systematic reviews, which together covered 379 individual studies and almost 192,000 people who had experienced pregnancy loss before 24 weeks. So this is actually a significant amount of research. And it looked at miscarriage, ectopic pregnancy, and molar pregnancy. And then researchers were also looking at things like depression, anxiety, stress, grief, and PTSD. They also looked at people's actual experiences of loss, not just numbers on a mental health questionnaire. And that's where I think some of the findings really get interesting. So let's start with depression. Across the reviews, pregnancy loss was consistently associated with significant psychological distress. For depression specifically, some of the research found the odds were more than 4 times higher compared with control groups. And across pooled estimates, the prevalence of depression ranged from about 26% to 43%, with the highest rates reported in both low and middle income countries. Now, that does not mean that 26 to 43% of every person who has a pregnancy loss will experience depression. The numbers do come from different studies, different populations, and different settings, but I think they do make something very clear, that the mental health impact after pregnancy loss is very significant, even if the loss happens early, and it deserves to be taken more seriously. Anxiety was shown to last much longer than people realize. The researchers found that anxiety could remain elevated for more than 12 months after a pregnancy loss. The risk did tend to decrease as more time passed after the loss, which is important to mention. But we're still talking about psychological effects that for some people are there a year or more later. And that's really important because there can be this expectation that after a few weeks, maybe a few months, even the first year, that you should just be better. But we all know that grief doesn't work like that. It doesn't matter when the loss happened. There is not a deadline for where you suddenly wake up and you're okay and you're done grieving. So the numbers around grief itself were probably some of the most striking to me. The research found that 94.5% of people experienced acute grief within 48 hours of their loss. And for some people, that grief persisted for months or even years. And again, that doesn't mean everyone experiences grief in exactly the same way or for exactly the same amount of time, but it shows just how common and how significant of a role grief plays in our lives after pregnancy loss. And I think that we sometimes forget that the physical recovery and the emotional recovery are two completely different things. Your body may physically recover from a miscarriage. You may go back to work. You may be taking care of your other children. You may laugh and have good days again. And you can still be grieving your baby. Both things can be true at the same time. The researchers also looked at post-traumatic stress. And these numbers were significant too. Shortly after pregnancy loss, post-traumatic stress symptoms were reported in 80 to 82% of women in the research included in the review. At longer follow-ups, the prevalence of PTSD ranged from 18 to 29%, and the long-term risk of PTSD remained significantly elevated compared with the control groups. Now, again, this doesn't mean that 80% of people who experience a pregnancy loss develop PTSD. This number refers to post-traumatic stress symptoms shortly after loss, which is a little different from receiving an actual PTSD diagnosis. But it definitely shows that pregnancy loss can be a very traumatic experience and that we shouldn't minimize that just because the loss happened early. Now, the numbers weren't the only thing researchers looked at. This is one of my favorite parts of the review because the researchers also looked at people's actual experiences and identified 5 major themes. So one of these was coping and meaning making, basically how people try to make sense of what happened and how they learn to live with their loss. Another of these was invisible loss and disenfranchised grief, which we have talked about a lot on this show. And I think a lot of people listening understand how that feels. You can lose a baby that you had already imagined an entire future with, but the rest of the world may never even know that baby existed. You may have already calculated your due date, thought about a name, pictured what Christmas would look like that year. Maybe you had spent months or years trying to get pregnant, and then in an instant, it's just over. And then there may not even be a funeral. There may not be a public acknowledgement. Sometimes there aren't even people who know you're grieving. The loss can be enormous to you, and it's almost invisible to everybody else. Another theme that the researchers identified was something they called the social hierarchies of grief. And this is a really important one. We sometimes assign different levels of legitimacy to pregnancy loss depending on when or how it happened. People make those comments like, well, at least it was early. At least you know you can get pregnant. You can always try again. And usually people aren't trying to be hurtful. They're trying to find something positive, something helpful to say. But as we know, these comments can make someone feel like they aren't allowed to grieve as deeply as they actually are. How many weeks pregnant you were doesn't tell someone how wanted that baby was. It doesn't tell them what that pregnancy represented to you. And it doesn't tell them what losing that pregnancy is going to mean for you either physically or emotionally. The other themes that researchers identified were renegotiation of future parenthood and identity disruption and distress trajectories. And I think those two are kind of connected. A pregnancy loss can completely change the way that you think about future pregnancies. Before loss, a positive pregnancy test often means, okay, I'll have a baby in 9 months. But after loss, that same positive test doesn't mean that anymore. And it comes with a million new emotions all at once. Excitement, fear, hope, anxiety. And it can change the way you see yourself, see your body, and see the future you had imagined. And that's another reason why the emotional impact doesn't necessarily end when the physical pregnancy ends. As always, there are some limitations to the research that we need to talk about. Even though this umbrella review included a huge amount of research, it doesn't mean that all of the research was equally strong. Of the 18 systematic reviews included, 6 were rated as high quality, 9 were low quality, and 3 were critically low quality. There were also significant differences between the studies in how they defined and measured different mental health outcomes. Some of the individual studies overlapped between reviews. And unfortunately, there was much less research specifically about ectopic and molar pregnancies than there was about miscarriage. So we can't take the numbers and assume that they apply exactly the same to every single person or every type of pregnancy loss. The researchers themselves say the differences limit how precisely we can interpret the findings. But even with those limitations, the overall pattern is what we're looking at. And it was consistent. Pregnancy loss before 24 weeks was associated with significant and sometimes persistent psychological effects. For me, research like this isn't important because we need science to prove that someone's grief is real. If you've lost a baby, you definitely don't need a study to tell you how to grieve or give you permission to grieve. But research can change how pregnancy loss is treated. It can influence hospitals, healthcare providers, mental health care, and bereavement programs. And hopefully, even the way our friends and family understand pregnancy loss. The researchers specifically said these findings highlight the need for psychological support that doesn't just exist immediately after the loss and then disappear. They called for structured, inclusive, culturally sensitive support that extends beyond that initial period, right after pregnancy loss. And when we're seeing evidence that anxiety can remain elevated beyond a year and that grief can persist for months or years, I think it's pretty easy to understand why. So if you'd like to read this research yourself, the study is called The Psychological Impact of Pregnancy Loss Before 24 Weeks Across Time and Income Settings, an Umbrella Review. It was published in the July 2026 supplement of Human Reproduction. The information we're discussing today comes from the published conference abstract, so we don't have all of the details that we would from a full-length paper. That's another reason I think it's important to be careful about how we interpret the individual numbers. So if you've experienced a miscarriage, ectopic pregnancy, a molar pregnancy, or really any pregnancy loss before 24 weeks, the biggest takeaway here: your loss mattered. You don't have to justify why you're still grieving. You don't have to be over it because a certain amount of time has passed. And how many weeks pregnant you were doesn't determine how much you're allowed to miss your baby. And if you're struggling with your mental health after a loss, please consider reaching out for support. It can be your healthcare provider, a mental health professional, a support group, or just finding other people who understand what you've gone through. And if you're supporting someone who's experienced a loss, you don't have to find the perfect thing to say. Just acknowledging their baby, acknowledging their experience, and giving them space to grieve is enough. If this episode resonated with you, please consider sharing it with someone who might need it, or leave a quick review on Apple or Spotify. Thank you so much for tuning in, and remember, we are all in this together.